Hi, my name is Monica Trujillo, and I'm the Prevention Coordinator for New Mexico HIDA. New Mexico HIDA's effort in substance abuse prevention have been focused on establishing statewide connection and fostering collaboration. To achieve this goal, we have initiated quarterly prevention meetings where all prevention initiatives across the state are invited to participate. These meetings serve as a platform for prevention professionals, organizations, and community members to share best practices, resources, and strategies. In addition to these meetings, we have launched the New Mexico Path to Prevention newsletter, providing a valuable opportunity for individuals to stay informed and engaged. Through this newsletter, we aim to disseminate information and showcase prevention work happening throughout our state. Our goal is to empower current programs and highlight the positive impact of prevention efforts. We firmly believe by working together towards a common goal of promoting wellness in early development, we can amplify our impact and create a lasting positive change in New Mexico. Together, we can build a strong network of support and empower individuals and communities to thrive. It is my pleasure to introduce our first panel of the day, which will bring to life the essential principles and pillars of school-based prevention systems. These panelists have extensive expertise in supporting, selecting, implementing, and evaluating prevention strategies in school settings. Together, they will draw out the importance of school-based prevention system and key considerations for building that system. Our first panelist is Dr. Chris Bosworth, former middle school teacher and emeritus professor at the University of Arizona College of Education. Dr. Bosworth's work focuses on the role of school climate as a buffer for individual risk factors for risk-taking behavior. Her model, Protective Schools, has been the centerpiece of 5 federally funded projects in Arizona and has been implemented in schools nationwide. Our next panelist is Dr. Zilli Sloboda, president of the Applied Prevention Science International, a not-for-profit focused on training and supporting prevention professionals worldwide. Dr. Sloboda has served on the faculty of several universities and is also a prior director of the Division of Epidemiology and Prevention Research at the National Institute of Drug Abuse. She was a founder of the US and EU Societies for Prevention Research and is well published and highly acknowledged in the area of drug abuse epidemiology and substance use prevention. Our third panelist is Dr. Paula Smith, Associate Professor at the University of Utah. Dr. Smith is a developmental psychologist with expertise in school-based prevention in middle and high schools. Her research centers around maximizing youth and young adult potential with a focus on the intersection of schools and juvenile justice systems. She also runs a project with Utah's Public Institution of Higher Education to develop student-led coalitions to improve mental health and decrease substance misuse among college students. Our final panelist is Dr. Pamela Buckley, Associate Research Professor at the University of Colorado Boulder. She is also Principal Investigator of Blueprints for Healthy Youth Development, an outline clearinghouse of effective and scalable prevention programs for youth. Dr. Buckley's scholarship focuses on interdisciplinary and applied research to understand what works, for whom, and in what setting, and in generating reliable evidence for preventing negative outcomes and fostering well-being among youth. On behalf of New Mexico HIDA, please join me in welcoming our panelists.
Hello, everyone. Welcome back. For those of you just joining us, many of you are joining us from the West Coast. You're just waking up. I'm Laura Papard, Director of ADAPT and Deputy Director for the Washington-Baltimore HIDA for Treatment and Prevention. We are here at the 2024 HIDA Prevention Summit, and we are now launching the first of several panels today on the topic of school-based prevention. We wanted to launch with this particular panel because this summit will release 3 new resources. And the first of those resources is something called the School-Based Prevention Guide, Pillars and Principles of School-Based Prevention. And this guide was a labor of love. It was put together for multiple communities, multiple states that have submitted TA requests that look something like, how should I think about school-based prevention and my contributions or my role within that? Or how should I think about integrating new substance-related content into my schools? Or how should I think about integrating this new legislation that's just come out? And the answer to all of those questions really grounded in, well, first of all, how do we think about school-based prevention? So what we've done is put together this guide, and I want to be very transparent about this guide. We reached out to several organizations: National Prevention Science Coalition, Applied Prevention Science International, the University of Arizona College of Education, Blueprints for Healthy Youth Development, and even Dr. Christy Bethel's organization at Johns Hopkins and the Child and Adolescent Health Measurement Initiative. And we asked them, hey, would you guys mind coming together with us and at least putting down some thoughts related to a way of thinking, some common denominators across an approach to school-based prevention. And what the ADAPT team did was we ended up searching the literature and crosswalking or reconciling 5 different frameworks that existed out there, and we talked with some of these organizations that are very commonly used in schools, but also well-respected, grounded in the best available evidence. Some examples of those frameworks include PBSS, MTSS, RTI, Project Alert, and Protective Schools from the University of Arizona. And so we reconciled all those, we drew down the common denominators, and what that manifested into was really 5 components related to school-based prevention and 4 guiding principles. And so what you'll see on your screen is a very honest and transparent attempt at creating a purpose for this guide. This is not, if you want to implement a comprehensive school-based prevention structure, this is going to be a complementary guide for you, maybe a starting point for thinking through the essential components. But the beauty of this guide is we are extracting and drilling down to need it to be done. Okay, I'm seeing that I'm being muted and unmuted. Give me a thumbs up if you can hear me. Okay. I'm going to keep going. I'm assuming everyone can hear me again now. So the purpose of this guide really was to ultimately end with those opportunities, because so much is out there that we can be engaged in as communities to support the schools in doing this important work. So very quickly, I'm going to talk you through the guide. You see that it's divided into 4 components. We're going to start with these principles. As I mentioned, they're kind of this guiding mindset. They're threaded throughout all of the pillars of school-based prevention, but they really represent that flow and that bloodline throughout the pillars. And these are the must-haves, the important pieces of the thought process and thinking through. You've got to have a systems approach, a systems lens, right? You have to have multi-level strategies within the pillars that make sense and address the various levels of risk. You need to use the best available evidence at all times and evaluate, if you don't have it, any new strategies that you are implementing. And then everything you do needs to be data and outcomes driven. So these are the guiding principles of this specific product. And then moving on to the 5 pillars, again, these are what we crosswalked across these 5 frameworks. And these stood out as more of those concrete sets of strategies that you can really think through and anchor in with your community partners to activate a comprehensive prevention system within your schools. And so you'll see here, we're talking about things like positive climate, infrastructure support, doing your needs assessments, any academic and prevention strategies that are, again, leaning into that principle of best available evidence. And then finally, looking at our outcomes and monitoring them. So this final slide that draws you into the guide a little bit more, and I think we're posting a link to that guide on our Prevention Intervention Resource Center, so you can all draw it down right now and take a look at it as we go through. This is kind of the innovative piece of this guide. After we went through these common denominators, then we were like, all right, now what? We have created with both end users and science experts where some of these natural opportunities exist among the pillars for that community engagement piece, again, for the purpose of helping schools build capacity to do this work. And then we also, thank you to our external reviewers, have provided examples, real life examples. These have been done and are currently still being implemented across the nation. So we have drawn those out in the guide as well for you. All right. That's an orientation to the guide. And what we're going to be doing now is I'm going to invite our panelists to bring this to life for us. Let's bring these concepts to life. We have panels throughout the day that will apply it, but we really want to stress the importance and understand why these particular pillars are seen as common denominators. So I'm going to start with Dr. Sloboda. Thank you all for joining us today, panelists. Dr. Sloboda, we noticed that a systems approach is one of those guiding principles of school-based prevention, and that schools will want to assess their needs in a variety of ways as one of the essential 5 pillars of prevention. Both of these things are pretty broad, often overwhelming concepts. Help us understand what is meant by a systems approach and how we might think about the important pieces of a needs assessment. Dr. Sloboda?
Thank you, Laura, and good morning, everyone. We're talking about systems, prevention systems. When we think about prevention, particularly of risky behaviors such as substance use, we need to think about the understanding the processes or the other factors that are involved in influencing those behaviors. And that whole field of research and exploration is called etiology. And before you is an etiology model. It's a much simplified version than the one I created that's very complicated. So what it says here is, first of all, our behaviors influenced over our lifetime. And there are different factors that influence that behavior. There's our micro level environments, those are your families, parents, and then there are macro level environments. And I've added climate change because I think that's becoming a real issue these days in influencing how we behave. Just look at what we just experienced with Hurricane Helene. So when you think about it and think about when I present this model, think about yourselves as growing up in your family. And think about those of you who are parents, think about your children. Each of us are, even though we share the same genetic pool, our parents are we have the same pool, our brothers and sisters. We are different. My brother was different than I am. My daughter's different than her brother, and they're different in many ways physiologically. Temperament is probably a big one, a big factor, and how we interact then with our environments has a lot to do with how we visualize that environment, and how we share that environment, and how we interpret the environment. And those influences, therefore, they influence our beliefs, our attitudes, and norms, and then ultimately those factors are related to behavior. So the etiology model is really important in prevention for a number of reasons, but principally thinking about that these different environments for prevention. We're very fortunate in 2024 to have had a lot of research in this area, and we have a lot of interventions for each of these environments. And I put the stars where we have really evidence-based programs that can be instituted and fostered in communities. Excuse me. When you think about all those different factors, then we really should be talking about systems, because we need to, if we're going to address prevention, we want to have a delivery system that includes interventions at each of those intervention points. And my colleague, Denny Fishbein, and I published this article last December showing what we think a prevention service delivery system should look like. And in the bottom, you can see the school is having a prominent role in that system. So why do schools matter? Schools are one of our most important settings outside the family for socializing our children. They not only educate our children, but they shape attitudes. Uh, they teach roles and behaviors, and they provide them children an opportunity to practice behaviors that they will take on as they get older under adult supervision. So it's very similar to a family situation. So what does the school look like? The school itself is a system. It has all these different component parts. Has, administrative staff, principals, the heads of departments and teachers, the sports coaches, even the cafeteria staff and janitorial staff. And in my experience growing up, our crossing guard, who was a local law enforcement officer, his name was George. I don't think I'll ever forget him. He really was somebody that all of the kids went to for advice. So that system, even though the system is principally focused on teaching and educating, they're also what we call socializing, helping children prepare for adulthood and taking on their role in the community. But the school is not a closed system. It is an open system. It's influenced by our parents. It's influenced by folks, local businesses, local government offices. It could be local or state, the educational societies, could be national, law enforcement, media, etc. So that the system, but the system itself is open. If you look at it as a closed system, then we look at how that students don't stand apart from the school personnel. There's an interaction, and they all impact each other. So you have teaching staff that directly relates to students, but they also relate to the families and other aspects of the school. So if you think about that, then we know that substance use not only affects what happens in the school, but also substance use outside of the school impacts the behaviors that we bring into the school environment. And we're focused here on children, but remember, there was adults who also might be experiencing substance use, who may be smoking. There's smoking areas in schools. There might be a party over the weekend, and Monday the faculty, the teachers come in having had partied a bit much, and so they're bringing those behaviors into the school. So substance use not only affects children, it affects the whole school environment. And that's why we're taking a systems approach. So that when we're talking about prevention, you'll hear more about this later. We're talking about not only the school policy, which is really important, in having school policy that's very clear to both members of the school and students, but also parents and the community understand what school policies are regarding substance use on campus, but also off campus. We're talking about the school climate. This is supposed to be a safe environment for students where they can thrive. And that's important to create that kind of climate. And when you have a thriving climate in school, it also helps with the faculty. teachers thrive in those kinds of climates. And finally, of course, having those pieces in place, introducing an evidence-based prevention curriculum then is very powerful. So I'm going to be talking a little bit about needs and resource assessment because we need to sort of set a foundation. If we're talking about systems, then how do we introduce prevention approaches into this system? So a needs assessment is part of a strategic planning process. Many of you probably are familiar with needs assessments, and you want to look at what the challenges are in the environment and how to address them, and then what resources are available to overcome those challenges and to enhance goal attainment. And as I just remind us, we're not only talking about student substance use, but we're also talking about school substance use. So that has to be taken into consideration when you're doing a needs assessment and a resource assessment. What kind of data are usually collected in needs assessment? There are a variety of different data. I'm focusing on those that are obvious. Substances being used, um, how they're being used, frequency of use is important to know. Where the substances are coming from. Are they medications from the household that children have access to? Is somebody coming on campus to sell substances to children? Are they sharing cigarettes? Are they sharing alcohol? Are they going to parties? So we need to know where those substances are made available. And then we want to know something about the characteristics, not only about the children, but also what the impact is of substance use in terms of absenteeism, etc. You have to forgive me because I'm an epidemiologist. So these are the kinds of things that we're interested in. Is we want to know about age of first use. The age of first use generally is early teens into mid teens. However, recently the age is lowered, and so this is something of concern for elementary schools also. Of course, as every use, there is often people who try using, but they don't continue using. But we are concerned about both populations. And then, of course, as I mentioned, the consequences of use are really important for us to understand. Where do we get the data from? Well, there's the quantitative data. We classify quantitative data in archival and surveys. And then there's qualitative data, which is we usually use focus groups or key informants. And if you're going to do a really good needs assessment, it'd be nice to have a combination of both, but at least try to begin with something. I always recommend starting with archival data. In schools, you have valuable information that you can look at. You can look at violations of substance use policies. You can look at your referrals for health and mental health problems. Look at absenteeism and truancies. You see some patterns there that you might want to investigate further. Law enforcement also has available information that they can provide to schools in terms of adolescents who are getting into trouble. Um, Hospital emergency room data, I think, is really important and very informative. Just locally in our town, we have at least one overdose a day showing up in our emergency rooms, and we're a moderately sized community of about 50,000. And what we're noticing over the last several months is that the age of people coming into the emergency room, I would say 10% of them are under 16 years of age.
Dr. Sloboda, thank you so
Yes.
much. I think you are almost at the end. Let's go ahead
Okay.
and
And
advance.
I just wanted to comment about surveys. There are surveys available that you can use to replicate in your own environment. And I would suggest doing that instead of inventing your own. And many schools already are doing some of these, particularly youth risk behavior surveillance survey. Thank
Thank
you.
you so much. Thank you. You've really set the stage for thinking through how do we approach this at large, and then how do we get started with some of that data. I'm going to move on now to Dr. Bosworth. Dr. Bosworth, two additional pillars that are identified in the school-based prevention guide include positive school climate and infrastructure support. Again, concepts that aren't necessarily intuitive. What do we even mean by climate and infrastructure within a school setting. Bring that to life for us.
Okay, thank you. And thank you, Dr. Svoboda, for setting the stage about the systems approach. And what the protective schools model is marrying the systems approach to thinking and with a traditional way of thinking about the levels of prevention interventions. Schools will call them tier 1, tier 2, tier 3. Prevention scientists will say universal, selected, indicated. So I think about this as in terms of tooth decay. So if you have fluoride in your water, you're going to prevent much of the tooth decay in children. However, there are always people that cavities occur, so you need some selected systems, dentistry, to take care of those cavities. And then there are people who have wrecks of mouths of teeth, like me, that need an indicated system, and I've had almost every type of dental bridge work and implants and whatever. I need tier 3 interventions. And so that's what we're looking at in terms of the prevention in the schools. And the thing is that the universal prevention, which is something for everyone, really diminishes the number of children that end up in tier 2 and tier 3. So let's talk a little bit about what this is. When a flower doesn't bloom, we change the environment in which it grows, not the flower. That's the whole, keep that in mind. So I'm going to first talk about policies and then about climate. An effective policy, an essential component for a healthy, safe environment, so people know what the rules are. And I would like to recommend, if people are going to be developing policy, the state of Maine has put together an awesome guide on how you develop policy in substance use. And I think it is listed in the resources. Our school is committed to safety and well-being of our students, staff, and family is one of the philosophy statements that the Maine guide recommends. And so here are the components of an effective policy. You need to have a philosophy statement. You need to have the behavioral expectations. What are the positive behaviors you want to see in your students? But you also have to say what is prohibited, how it's going to be enforced, what are the consequences, and then what are the interventions and treatments. So these are guidelines that are for a strong policy within schools. The policy itself is important, but one of the key things that integrates the systems approach Dr. Sloboda was talking about is how do you make this policy? And one of the things that is key is stakeholder involvement. The school and the school board are still the arbitrators, are still the decision makers. Policies need to be approved generally by a school board. So they need to be made within the school structure. But stakeholders of parents, children, kids, students, and community members need to be involved, need to be well communicated. The policy needs to be well communicated. Staff need to be trained to know what they're doing, and the consistency of enforcement is truly important. Need to collect evaluation data on who is on different groups or what kind of violations are occurring. And you need to review the policy often. It's a living document, and as systems change, the policy may change as well, need to policy to make change as well. So moving on to climate, what is school climate? It's a squishy policy, it's a squishy word. It's the quality of life in school. It reflects norms, goals, values, teaching practices, organizational structures. Some people will say you can get a sense of the positive nature of a school climate by just walking in the front door of a school and seeing what's on the walls, seeing how people are greeted, seeing how the furniture is organized in there to make it a welcoming place. There are a couple of schools that we visited that have a basket of toys sitting and children's books for the parents that bring their young children to school for some reason with their students. So effects of a positive environment, it is not a panacea. You are not going to end all problems with a positive climate, but research has found that attending a school with a positive climate decreases absences, suspensions, substance use, bullying behaviors. And you can see how then this tier 1 intervention of climate then reduces the number of people that fall into the tier 2 and tier 3 categories. It increases in a positive climate, students have better academic achievement. they're more motivated to learn, and there's better feelings of psychological well-being. So how does this work? It's a foundation for school-based prevention. It helps to keep people safe, but it also, the mechanism by which it works was discovered by a group of pediatricians at the University of Minnesota and Johns Hopkins that completed the ADHEALTH study, which followed 90,000 adolescents over a 4-year period in 71 school districts in the United States. And what they found was the untapped power of schools to improve health. Now, these are pediatricians who are a little surprised at what they found. And they named their concept connectedness, that students that are connected to school have decreased use of negative substances and negative behavior. Well, connectedness is one of those kind of squishy concepts. And here's how that's defined in the ADHEALTH survey. It's defined as feeling close to people at school, being happy at school, feeling that you're part of this school, seeing that students are treated fairly, and that you feel safe in the school. I'm going to show 2 graphs that illustrate the power of connectedness. The first one is looking at marijuana, cigarettes, and alcohol. And if you notice that students, this is an average of students that don't feel connected are much more likely to be using all 3 substances. And as they feel more connected, they are much less likely to use those substances. A pretty powerful indicator. Look at also, then you look at deviant behavior, which would be office referrals, and violence. And again, you see exactly the same pattern. The students that don't feel connected are much more likely to exhibit these kinds of behaviors or report these behaviors. And then those that feel very connected are less likely to do that. We have put all this information, the systems information, into a manual called Protective Schools. And this is available on the resource list that you can you can download the manual, you can download our needs assessment tool and our planning process. And what it does is it looks at 10 different systems that need to be engaged in some way in creating a positive climate, in creating a school policy, and looking at having more of an impact on that climate. So all of these systems there, and the manual describes them in more detail. And so how do you do this? I mean, you've got 10 systems, you've got 3 levels of prevention. How do you get this done in a school that is also doing all kinds of other things, from football games to testing and learning math and French verbs? So what we have talked about is the basic organizational structure that needs to be in place in order to create a positive climate and a tier 1 a strong tier 1 program is a leadership team. And this brings together the faculty, administration, and sometimes students to organize and develop a comprehensive school plan, which begins with where Dr. Sloboda left off, with a needs assessment. Is where are the positive nature of climate in that school, and what are the issues that need to be worked on. We have also developed an online manual. This is an online manual called the Leader's Guide to Developing a Comprehensive School Safety Plan. The word is safety, not substance use, but you can easily change it into, and you can see how the strategies are exactly the same for safety and for substance abuse. So we're excited about the opportunity that a school has to develop a climate and to develop a school policy to be their tier 1 foundational prevention strategy that integrates other kinds of programs and other kinds of activities into a comprehensive prevention strategy. So thank you for your time. Thank you, Laura, for allowing me to have this opportunity. And I think we turn it over to Dr. Smith.
Yes, thank you, Dr. Bosworth. Dr. Smith, You've had significant experience synthesizing academic and behavioral supports for students through the multi-level strategies that Dr. Bosworth was just speaking towards. Talk us through the approach and help us understand the respective roles of the schools versus the communities in operationalizing a tiered approach.
Okay, so thank you so much for having me today. I want to talk a little bit first about this tiered model because what we want to do is make sure that schools are not operating in a way that, you know, really just focuses on academic instruction without understanding how to integrate behavioral instruction as well. We know that schools are responsible for both of these pieces, not simply one. So when we talk about these tiered models that Dr. Bosworth has referred to and that are also in your school-based prevention guide, we're talking about universal interventions. And so let's get on the ground and talk about some examples. So at the universal level on the academic side, this is regular classroom instruction, right? And then at the secondary intervention level, we have, students that need some additional supports, right? Not a tremendous amount of support, but they just need some additional supports, maybe in the form of small group intervention. And then at the third level, tier 3, tertiary interventions, we have students that need a lot of support, that need push-in services, pull-out services, but that really need a great deal of support. Now, notice these percentages. So we should have at the classroom level, right? We should have between 80 and 90% of students that are able to access the curriculum. And then about 5 to 10% who need some additional supports, and then about 1 to 5% who need lots of support, right? So we say these percentages for a purpose, because what we should be doing in schools is not having lots of reteaching and reteaching, but having having your basic classroom instruction really be targeted and really be effective for the vast majority of students. This is the same is true for behavioral instructions. So when you think about universal behavioral instruction, you have classroom rules as an example. So with classroom rules, the key is, and Dr. Bosworth has alluded to this, but they have to be consistent with the school-wide rules, right? So we can't have two different operating systems going on. This has to be part of a cohesive structure. So when we have behavioral instruction, we use universal intervention. So classroom rules are the same as school rules. So what they do in the classroom is the same as what happens in the hallway, is the same as what happens when they go to the restroom, is the same as when they go to lunch in the cafeteria, right? So all those rules are very, very consistent. At the secondary level, we have
Where's Fred?
folks that are just needing a little bit more support, right? So they need to be reminded about the rules. And then at the tertiary level, we have kids who really need a lot of support. Now, the critical piece about the tier 3 kids is that often we find kids who are behaving, who have behavioral difficulties, also have lots of academic difficulties as well. So this is why we try to pay attention to both into an integrated system, because we have behavioral challenges we know reduce access to academics. So these are the kids that are being removed from classes. These are the kids that are putting their heads down and not accessing the curriculum. And sometimes we've got some underlying attention or other deficits that are causing these behavioral or academic challenges. And then we also know on the other side that early academic challenges can cause social rejection. So these are the kids that are called, you know, inappropriate words like stupid or dummies, and that they have that academic fear, right? That they don't want to participate in any kind of academic challenge. And then that also could lead to behavioral problems, because when we call on students to read and they don't know how to read, we see some of these behaviors, like throwing books and, you know, that sort of thing. And then we also know that academic challenges can also lead to social or emotional problems. So feeling like they're not worthy to be in school, feeling like they don't have folks who are on their side in schools. So that's critically important. Now, what I want to do is give you an example. Now, I know we're talking about substance use prevention, but suicide and substance use are very intricately connected. So I want to give you an example of a study that we participated in. My team participated in a few years ago at the school district level. And the piece here is that schools often say, well, you know, we're here to teach, right? We don't have time to do these other things. And then on the other side, we hear communities say, you know, we want to help, but we don't have resources available to us. So here's an example of how, you know, these two systems, community and schools, can be blended, but also understanding how these tiers work, right? So at the tier 1, we have classroom instruction, differentiated instruction, you know, fabulous teacher education programs that really help us understand how to differentiate instruction. And then, you know, we've got at the academic and selective level, we've got small group academic support, again, structured support for students who either attempted suicide or, you know, had some mental health crisis, and making sure that those students really get those lessons that they missed, right? And then from the behavioral side, what these schools did was really at the base level, at the universal level, they implemented social and emotional learning programs district-wide, right? That was critical because, as Dr. Bosworth indicated, that's the level of getting fluoride in the water, right? So everybody gets the same level of fluoride. At the tier 2, what they did was create safe rooms in schools. So what these safe rooms are a place where students could go when they were feeling frustrated, when they were feeling overwhelmed, and they could get some relief. And they also provided in-school counseling. At the 3rd level, when we had students who either attempted suicide, who attempted suicide, we had parents engaged in a return to learn meeting so that we could address some of the issues, identify triggers, identify how can we better support this student. And then if a student died by suicide, so the suicide was completed, we had a connection to the county behavioral health department so that we could provide bereavement counseling for students and faculty and teachers and students and staff who were affected by the student's death, right? So a comprehensive system that was integrated. And I just want to talk about opportunities for teaming, right? So Dr. Bosworth indicated that it takes a leadership team, and schools and communities can team on these efforts, right? To promote healthy behaviors and prevent substance misuse and suicide. So at the school level, we had, the school reviewed and funded Tier 1 SEL intervention, provided district level data to community coalitions, right? And what that community coalition then did, first of all, they formed a community coalition that consisted of parents, businesses, prevention specialists, other people that were interested in addressing this particular issue. And what they did is they provided the families and communities with education, health fairs, resources to better understand what's going on in terms of suicide prevention for kids. And then, as a byproduct of that information that the school provided, they provided political pressure within that system to increase funding for mental health supports in schools. And that was critical because what it allowed us to do was to hire more mental health professionals. And then they also, from the community standpoint, they provided input for cultural adaptation of school-based materials and resources. So within our school system, we have different cultures represented, and some cultures have taboos against talking about suicide or, different ways to address mental health conditions. So we want to be sensitive to those particular aspects, and we want to make sure that communities are having input on how to do those culturally appropriate practices. And then on the last part was, again, the school collaborating with the community and collaborating with county mental health and local hospitals so that we understand when kids get released and from the hospital and how, particularly mental health hospital or physical health hospital, and how can we integrate those kids back into our schools. And here, importantly, we hear a lot about schools and communities not being able to team because of FERPA, which is a privacy act, right? So what they can't collaborate on is understanding who the particular kids are. But what they can collaborate on are those Tier 1 universal interventions. So I just want to encourage everyone to really think about the ways in which schools and communities can team in order to make these efforts around substance misuse and mental health promotion really a powerful combination. So thank you for the time, and I will turn it back over.
Thank you, Dr. Smith. And you know what? I love the synergy of not just the mental health and substance use concepts, but also the academic piece as well. Like you've really brought those to life together. And we appreciate you talking that through with us. We're going to end here with our final panelist, Dr. Buckley. There's no better way to end than talking about the best available evidence, right? So, Dr. Buckley, we've been talking about these evidence-based strategies. Best available evidence is one of the resources guiding principles. There are dimensions to the term evidence. Can you please break that down for us and give us a starting point for identifying strategies that have been demonstrated to work?
Absolutely. Thank you, Dr. Thank you, Laura, and thank you all for being here. I'll be quick because I want to make sure we have time for answers. And I want to get really drilled down to, we've had so much great information about systems, about why this is important. And I'm sure for those of you who are on the ground, you're asking the question, what might that look like? And that's the piece I'm going to try and address quickly. But I'm going to start with grounding this in evidence. And you've heard this term, evidence-based interventions or programs mentioned. What does that mean? And I'm now realizing, here we go, interventions that have actually been tested and they've been subject to rigorous review, but importantly, and I know because I've been a school psychologist, I've worked in schools, you want to make sure that not only has been tested, but it's clear for how I would implement it in the real world. So these have been translated for use with community-based organizations, including schools, and they've been vetted by evaluation experts who have no skin in the game, that don't make money off this information. We're looking at the science. So where can you find these strategies? There are many tools out there, and I'm going to introduce you to one. It's actually a free resource, and what we call them are online clearinghouses. And these online clearinghouses, there's many of them out there. They focus on the results of high quality research to answer the question, what works? And from these questions through the science, they actually generate an inventory of evidence-based interventions for people in the real world to then implement and adopt based on the needs of the communities they serve. I'm going to now specifically give you examples of two that are most useful to in school settings. One is called What Works Clearinghouse, and that is actually implemented and funded by the Department of Education's Institute of Education Science. And the focus predominantly is on academic achievement. So a lot of strategies, both tier 1, tier 2, tier 3, universal, et cetera, on learning how to conduct effective math and literacy strategies, teaching strategies. They also, though, in this clearinghouse have programs that are focused on social, emotional, and behavioral learning within the school setting. The vast majority of these programs in the What Works Clearinghouse focused on social, emotional are universal school-based. So they get at that tier 1. I'm going to talk to you a little bit more about a project I run called Blueprints for Healthy Youth Development. And really the focus of these programs are what we call upstream prevention. I'm going to define that momentarily, but importantly, 60% of these programs are implemented in schools that are on our registries list, and they provide strategies at all 3 levels: universal, indicated, and selective. So what do I mean by upstream prevention? And I think you're going to hear a lot about this throughout today's summit. We have 30 years of research showing that you actually can, it is possible to reduce negative health outcomes, including violence, suicide, as Dr. Smith just went through, and substance misuse before these behaviors occur. Determining and addressing the root causes and conditions that contribute to these negative health outcomes is what we call upstream prevention. And the goal of upstream prevention is to build resilience in our youth and families, to decrease risk factors, and to build protective factors so that we can have impacts not only on the individual at that point in time, but also on downstream public health outcomes downstream as the population ages. And Blueprints for Healthy Youth Development actually provides a registry of effective upstream prevention strategies that can be implemented either at the youth level within individuals, or at the family level, school level, and community level. And the goal of these interventions is to improve child development, support families, and enhance school experiences. So we've talked a lot about these evidence-based strategies in tier 1 prevention curriculum, and I just want to quickly give you an example of what that means and what you can find within these curricula, and then where do you go about implementing those solutions. So if we think about parenting skills and we think about substance use education for parents and caregivers, because we did talk earlier in this panel about we need to support the youth, but also the families from which the homes from where they're coming from. So Blueprints has several evidence-based strategies supporting families in developing these skills. What Works Clearinghouse has many programs that have been subject to rigorous peer review in terms of supporting classroom environment. Dr. Bosworth went through a lot of the importance of why we need to focus on that. What Works Clearinghouse has actual solutions and programs that you can implement at that level. Both Blueprints and What Works Clearinghouse have evidence-based programs that help youth learn how to build decision-making skills, problem-solving skills, coping skills, etc. Another example of evidence-based Tier 1 prevention curriculum would be building refusal skills and substance resistance skills specific to problem behaviors or challenging situations like substance use. And you'll find many of those strategies in the Blueprints database. And then again, getting back to some of the elements that both Dr. Bosworth and Dr. Smith talked about and Dr. Sloboda mentioned or touched on is the importance of feeling that kind of attachment to a school and school bonding. So a positive school climate, positive attitudes towards school, those types of strategies and evidence-based solutions can be found in the What Works Clearinghouse. Wow, that went through quickly. I'm done. And so now I'm
Okay.
going to pass it back to you, Laura. Thank you.
All right, thank you, Dr. Buckley. We're actually going to not address the monitoring and evaluation portion in this panel. It is in your school-based prevention guide. Dr. Sloboda has looked very carefully over those sections and contributed to them, so they offer a nice starting point to that pillar. We actually are going to wrap up with one question. This came in from 2 different audience participants. Panel, is there something you'd recommend to audience members who are receiving pushback from schools or from parents or caregivers related to school-based prevention? And we'll do this within 1 minute or less.
This is Dr. Smith. I think I'll start. I would say, I would tell schools, you're doing it already. You're just not identifying it as school-based as prevention. So you're doing it when you look at classroom management and making those schools as positive as possible, right? And I would also say that a positive school climate, if you can emphasize it to them, and I think Dr. Bosworth might key into this, that a positive school climate means everything in terms of positive outcomes for kids.
Thank you, Dr. Smith. Any other quick words of wisdom?
I think I want to, I know Chris for jump in here, but I think involving the parents in solving the problem and identifying the problem, let them be part of that process. That's what we're pushing here. That's what we're talking about. Their parents are very much part of that system we're talking about. So that's what I would say. Dr. Bosworth?
I say, I of course agree that the teachers are the foot soldiers for prevention. They're doing it every day, or they're working against prevention. And they're working to help kids feel bad about themselves and inadequate and those kinds of things, depending on the style and the nature of the classroom management and the classroom teaching. But I think we need to have a great deal of empathy for educators today. All of them are saying that the kids missed out on a lot of social skills during COVID. They're missing out on academic skills. They're revamping. The second grade teacher can't teach the second grade curriculum as she or he did prior COVID because there's so many learning and relationship gaps and social emotional gaps. So coming into meeting with school personnel with a great deal of empathy for the position they're in, and to provide as voters, to provide the resources, make sure that the school districts, the school boards, and the voters are providing the financial resources that the schools need to beef up their mental health services and other services. So it's really a hard time for educators.
Thank you, Dr. Bosworth, for putting that in perspective for us as well. Panelists, Dr. Bosworth, Dr. Sloboda, Dr. Smith, Dr. Buckley, thank you for sharing your expertise with us today and for bringing this new document and resource to life. We appreciate you joining us. At this
Thank-
time, we're going to
you.
be concluding this session and we will be hopping over to the next session titled Opportunities and Resources for Community Partners in School-Based Prevention. We'll just continue the fun and learn about some concrete examples coming forward from that panel led by Carlton Hall. We'll see you over there.